we actually have zero idea what the actual cost of healthcare in this country is, because the only thing we can really evaluate it by is how much the federal government is spending out, and then what they're charging in the facilities, which is completely detached from the reality of what that service would actually cost. So when we did our analysis and implemented what we were talking about here, we saw a 42% reduction in cost, which is a huge amount of money, but it's getting rid of a lot of the fabricated pricing that's developed over the last 40, 50 years because there were absolutely zero constraints on what they wanted to charge for things. So to me, it always leads back to understanding these goals and going down these goals so that we're addressing, for example, what do we mean by access? If we say a community should have access to healthcare services, what does that mean? We can't build a trauma hospital every 50 miles in this country. Distribution of resources. What resources? To whom? Where? How is it going to be led? What is the most cost efficient way to deliver that? The administrative team was another issue. How do you administer a health system on a statewide region unless you're doing it through the voices of the providers and the practitioners that understand what their services can and can't do, and the most efficient way to move those services and deliver them to so that every community is covered. And to me, that's the arguments I have against direct primary care and value-based care, is you're asking people to pay more so they have access to primary care, but they still need major medical because that primary care physician can't deliver, a kidney transplant. So to me, we have to go in with the understanding that we're talking every community, everybody that's living in the US. And if COVID taught us anything, it's how interconnected we all are and how fast it can go into the hopper if we're not paying attention and we don't have a health system who is paying attention, aware, and can respond as a system.